you talked a lot about this culture change in French. I mean, could you just describe a bit like this utopian version, I guess, that you have of the culture of our health system the way it should be?
If you ask me a quick answer, I would say HR. HR, HR. I think the most important resource that we have is human resources. That's clear. And if we have happy resources, we will have happy patients. So what we need to change is to say that most of our employees have still that in mind, that once upon a time, there was a culture of the patients. There was a feeling of being part of a team in one hospital. This has been lost. So when I refer to culture, a change of culture, it has to do with human resources. It has to do with the way we treat our people, that we can differentiate, that we're not asking the same thing to all people. It's not molten for everybody, and we need to pay people in proportion of the work they do. If they work at night, if they work at weekend, if they work in region, if they have a different training background, university background, we need to offer them different. That's respect for our employees. This is not the case right now. The differences are not sufficient for these employees to make the difference. And this is exactly what we do with this and what we're doing with the collective agreement that Mrs. Lebel is negotiating. The combination of this law and what's happening in negotiation will provide the tools to recuperate this change of culture.
I'm just wondering if you could give like a sort of a concrete example. Like, let's say, how is all this stuff we've been talking about today, how is that going to prevent somebody from waiting 54 hours in the ER at the Lakeshore Hospital, for example?
Yeah, well, I think that, and again, first, let's be clear, that's the reason I'm not pointing fingers to anybody. The first thing that we need to do is get back nurses and personnel in the system. Because the specialists and the GP are saying, we need people. We cannot operate full-time our emergency room, our surgeries, so we need people. Now, while we are getting those people with all of what we discussed, whatever internal agencies, differentiating salaries, all of what we discussed, I think that some of the doctors, whatever they are, me or GP or specialists, we need to make maybe more equilibrium between all of them to make sure that we don't have hole in certain services. And I think that for example, in French, we say le CRDS, le Centre de Rendez-vous des Spécialistes. I think we need to find solution with the specialists and the Omni to say it's not normal that we have 800,000 people waiting for an appointment. That doesn't make sense. So we need to find a solution for that. I think the measure that we are putting in place will be part of that solution. That's a concrete example of a target that we have.
What's your timeline specifically for when people can actually start to see a difference and connect that difference to this reform?
Well, as I mentioned, I think hopefully, since we have presented the health plan a year ago, people have seen some differences. Not at the level that we expect, because that's the reason we have been given an horizon of 2025. But I think that every day, and I think all the data that we have now allow us to measure us on a daily basis, on a weekly basis of all the improvement. And I think that each day when I come in the morning, and my colleagues, they know, the first thing I open the screen, and I look, say, what are we doing on our emergencies? How many surgeries I've been able to do? I'll tell you an example. On the surgeries that are late by more than 1 year, we went up to 23,000 about 2 months ago. And now, in the last 2 months, because of good efforts that have been done, especially by the specialists, we're down to 18,000. I mean, you say that's still too many, but we went down by 5,000 over the last 2 months. So I think every day, if everybody contribute the way we are saying, I think that's the way people will be encouraged that we are doing. When I say we, not me, not us, all the professionals that are the 350,000 people in that network. And we can monitor that every day now.
If a healthcare worker is watching this and wondering, what difference is this going to make for me day to day in my job? What difference is Santé Quebec going to make? How would you explain that to them?
Well, I think as Madame Bélanger has said, we would like them to be proud to work. I know it's difficult. We went through 3 years of pandemic. And I think that if we are able to give them good conditions, so instead of going to private or to agencies, they are able to say, oh, I can see the changes. Give us the confidence that we are working this turnaround that we do right now. And I think that they will be very proud to be part of the changes that we make.